Hello and welcome to Long-Term Care Policy and Management. This is Public Health 627. This is your week 4 video. I've tried to make this video a little shorter because the readings this week are a little longer. So this week is really your introduction to what is an actual nursing home. Like a SNF, which we talked about last week, a nursing facility or a NIF is a term based on regulation more on what it actually is. Nursing facilities provide residents with rooms, meals, personal care, nursing care, and basic medical clinical services. Now I'm going to take a step back and discuss the difference between residents and consumers. What you're seeing here is there's a difference in the language that's used in the federal government. Consumers is usually the broader term that covers everyone who's using medical clinical services. So when I say consumers, I'm usually talking about hospital or SNF patients. But I also could be talking about anyone who's utilizing medical services. Residents is a particular term of art that describes NF consumers. So when you talk about residents, you're usually talking about those people in a nursing home, in an assisted living or residential care. You're not talking about those in a SNF or a hospital. The reason for this is that residents come with an extra set of rights because they live somewhere. So again, what's the difference between a skilled nursing home and a nursing home? Well, the difference is mainly the payment sources, the staffing, the patient population. SNFs usually exist within a NIF, so that's what makes it confusing. If you walk into a large nursing home, they probably have an area, a wing, or a floor dedicated to be a SNF, but it's in the NIF. That's why physically, when you're in the plant, it can look very different. Many residents are very confused by SNFs and NIFs. As you can imagine, anyone who's elderly, has some dementia, or is not familiar with the long-term care system, this is a very hard concept to explain. So unlike last week, Medicaid pays for long-term care in a nursing facility. You get a semi-private room, meals, medical social services, medications, medical supplies and equipment, ambulance transportation, dietary counseling. Very similar to a SNF, except what? There's no rehab. Rehabilitation is the priority of SNFs. Maintenance is the priority of NIFs. So many residents don't understand that they are no longer, while they're still in the same building, they no longer get the rehabilitation they were getting under SNF. So like PT, OT, speech. That's usually the main indicator that they're no longer SNF, they are now NIF. A lot of patients don't get this because they're in the same building, maybe they're on the same wing or even in the same room, but they're no longer getting the rehabilitation services they were once getting. Now, what nursing facilities do is maintenance. So they don't want people to lose these skills that they have, so they can do maintenance, but they don't do basically rehabilitation. Transitioning from a SNF to a NIF is one of the most confusing parts of long-term care. If a consumer is in a SNF but can't go home because it's not safe, they're usually transferred to a NIF bed. Because the insurance changes from Medicare to a Medicaid or private insurance, that usually becomes the focus of the conversation. And not really is it about the understanding of the change in the medical model. So many residents of a nursing facility don't understand what changed when they went from a SNF to a NIF. How much does it cost? NIFs will likely take private insurance, Medicaid, and private pay. Facilities will charge probably different amounts for each, so it's hard to give an estimate of how much it costs. The private pay amount for a NIF is likely to be different from how much they would charge Medicaid, which is also different from what they would likely charge a private insurance company. The daily rates of a NIF bed can range anywhere from $100 to $400 to more. A lot of factors can play into how much the bed costs because if it's a private pay, there might be a discount if a longer term contract is signed. So it's hard to really give an accurate picture of how much a NIF costs. NIFs are controlled by the state, not the federal government. So where you had Medicare paying for SNFs, they give a lot of rules with that SNF money. Now, NIFs are paid for by private payers and Medicaid, so the rules tend to be state by state based. So you're going to see a lot of variation in NIFs from one state to the next. So, in terms of NIFs, think about the broad concepts and don't get stuck in the particulars, because one state might have one rule that doesn't really translate to the next state over. The book talks about specialty units. So many states are now creating these specialty units. They're basically a NIF level of care. So you would qualify to be in a nursing home, but they've created what's a specialized unit within a NIF or a standalone unit. So the most popular of these is probably the brain injury NIF unit. They also have specialty Alzheimer's or youth units. These units are usually much more expensive because on top of the regular services they would provide something else. So if you're interested and you want to check out in your own state, look for specialty units to find out what there could be. So the exploratory this week section has a couple of extra parts about rights and protections of residents of a nursing home, which you will probably get into a little bit more later in the semester, but if you're interested in it, check it out. So again, I didn't want to give you a long lecture this week because we have a couple videos and we have a lot of reading. I'm always here for your questions, comments, or concerns, and I'll see you in the discussion board.